Hey folks, Jason Burns with Athletic Solutions of Punta Gorda. Today what we're doing is going over a cluster of tests to check for PCL tear, posterior cruciate ligament of the knee. The first test that we're going to start with is called the posterior drawer test. So we have our patient in supine. We have about 45 degrees of hip flexion, approximately 90 degrees of knee flexion. Our other leg will be fully extended. When we're doing these tests, we always want to check the unaffected side and compare that to the affected side to give us a good indication of whether or not we have a tear. We'll see a difference in the amount of movement, the amount of translation. So we'll have our foot planted firmly on the floor or on the mat, creating that closed chain. We can anchor that foot with our knee, or we can sit on it. We'll go ahead and with our thumbs, we'll palpate the joint line medially and laterally, wrapping our fingers around to the posterior aspect of the tibia. With the posterior drawer test, because we're applying a posterior motion of the tibia on the fixed femur, we want to use the thenar aspects of our thumb and go ahead and plant them on the front of the tibia, find our joint line, and we want to give a posterior force. What we're looking for is a translation of this tibial plateau posteriorly, and that will be indicative of a tear, the PCL. The next test that we're going to do is called the Godfrey's test, or the posterior sag sign. Very easy. We bring our patient up nice and relaxed to about 90 degrees of hip flexion, about 90 degrees of knee flexion. We can support the heel or the distal calf, and we just hold it and we look. We take a look at the tibial plateau, the anterior aspect of it, and if it sags in a downward direction, that would indicate to us that we have a PCL tear. We see no sag right here. We have a nice hump of the tibial plateau, which is exactly where it should be, the tibial tuberosity. So negative test for that. And the final test that we can do is a reverse Lockman's. Just like the Lockman's, we want to go ahead and we want to extend the knee out a little bit more. We're looking at about 15-20 degrees of knee flexion. We'll go ahead and fix our distal femur with our backhand, and we'll create a posterior direction of the tibia with our other hand on the femur, and we can go ahead and give a little pull forward and then push down or posteriorly into the table, and we're looking for laxity with the downward motion of the tibia on the fixed femur. So those are our three tests for the PCL. Thank you very much for tuning in.